but an ambulance or fire service or emergency medical service that's capable of providing what's called advanced life support. And they're able to put intravenous lines in to supply medications and fluids to the body. They're able to put specialized airways in so that they can breathe for the patient. And they're able to put them on a regular cardiac monitor so they can see what the heart rhythm is doing, what the heart rate is doing, and hopefully correct it right away. In most cases in Central New York area, an ambulance that comes with an advanced life support provider can do exactly the same things wherever they are in the field as can be done in an emergency room. So it's important that your first reaction to an unresponsive patient is to call 911. Now, a lot of people make the assumption that if I'm there and there's other people around, someone's going to call 911. What we find today in emergency services is if there's a group of people, either 99 people called 911 and one person didn't, or nobody called 911 because they wanted to see what that one person that was helping out was going to do. So it doesn't hurt to have additional calls to say, we have a victim that's laying on the ground or on the floor, is unresponsive, and we need help. Once I've determined they're unresponsive, I've called for help from 911. I want to know if their heart is beating and if they're breathing. By tilting their head back a little bit and lifting their jaw, I'd be able to see if their chest is rising. In our normal breathing cycle, our chest expands and contracts to allow air to go in and out. If the chest is not moving, the patient is not likely breathing. Typically, what we try to tell you is if you have a patient that is not responding, their chest is not moving, they don't look like they're breathing, and their face is turning blue, their lips are turning blue, their fingernails are turning blue, or they have a very ashen or gray color, is when you want to start CPR. We need to get the blood pumping through the body that's collecting the oxygen. The other portion of pumping the blood is supplying air for the patient to breathe. If you don't have a device to protect you from the patient and separate you from coming in direct skin contact, then you need to not do emergency breathing for them, but just do chest compressions. As I said earlier, 20% of the air we breathe in is oxygen, and we're only using a small portion. So as they're breathing out that last couple of breaths, there's still a lot of oxygen trapped in their lungs. By simply moving the blood around, we're going to help them. If we were looking for some form of barrier device to protect them from ourselves, there's a lot of different devices. This is a small packet on a keychain that you could purchase. And inside is nothing more than a plastic sheet, a couple of elastic bands to go over the ears, and a little barrier device, a little diaphragm on it that protects the patient from me and me from the patient. So if I was to put this over their mouth as I'm breathing, I'm not coming in contact with their skin. There's very rare instances where there's some form of communicable disease that could be transmitted from the victim to the rescuer. It's very seldom documented that anything like that happens, but it's not a risk worth taking if effective chest compressions could do the same thing. If you have a barrier device, you are only increasing the chances of survival. When the emergency medical services come, they use a bag valve mask, or BVM, to supply the air. And the mask goes over the face, and they squeeze the bag that supplies air to the patient. Because they're carrying tanked oxygen, they can hook oxygen up to a reservoir, which gives that patient approximately 100% pure oxygen as they're breathing for them. In the case that you're the rescuer on the street, and especially if someone comes along and hands you the packet with the defibrillator in it, there typically is a mask, a face mask inside the case with the defibrillator that you can use to protect yourself from the patient. In order to get the blood to move, we need to provide compressions on the chest in the center of the breastbone so that we're compressing the heart between the breastbone and the backbone as I'm pushing down.